All right, Dr. Hall here. This is our final section of the second lecture on contraception. We're going to be talking about sterilization. And by sterilization, we mean permanent, irreversible birth control. So if you are absolutely sure that you never want to have children in the future, then you might be interested in sterilization. So one of the most commonly performed types of sterilization is tubal ligation. Ligation means kind of a cutting off or a separating of. And so this is closing off the fallopian tubes. So that way an oocyte that's released from the ovaries cannot get far enough through the fallopian tubes so that sperm coming up this way could get to them, right? So if we cut, right, and get rid of that connection between those two parts of the fallopian tubes, then the sperm and the oocyte cannot meet. There will not be fertilization, and therefore there will not be pregnancy. This requires you to kind of do surgery in an operating room. Typically the person is under general anesthesia. So it's kind of a bigger surgery, but it's very effective. Now you'll notice at 99.5%, it's not quite as effective as having the implant, which you might think is totally crazy. But the reason for that is that bodies tend to try to heal, and sometimes these cut off ends kind of try to knit back together. So there certainly have been some occasions where people who'd had their tubes tied, which is what it's often commonly referred to, ended up getting pregnant later down the road. Not common, but can occasionally happen. Another way to do the same thing, but without having to do a surgery in an operating room under general anesthesia, is a procedure done in the office where they place these special coils up in, you'll recognize the isthmus, that narrow part of the fallopian tube where it attaches to the uterus. So this is done in the office, so it's less invasive. You don't have a big, you don't get cut open on your abdomen. They just go in through the vagina and the cervix. And so a lot safer in many ways, still really effective, and perhaps just as, if not more effective than a tubal ligation. But there are some potential risks. As you can imagine, you can't really see what you're doing all that well because you can't see inside the uterus all that well when you're just in the office. So there's some risk that perhaps these coils might migrate or move or cause some scarring or some pain. So it's something to talk about with your physician if this is something you're considering. On the male side of things, we have a vasectomy. So this is cutting of the vas deferens here, right? So that sperm, which as you know are manufactured in the seminiferous tubules of the testes and then mature in the epididymis, cannot get up out of the scrotum and into the urethra here, so they can't get out of the male body. Now you might wonder what's going to happen to the poor little sperm if there's this blockage here, the end of the road, it's a dead end, and they just die and get resorbed by the body. So you don't have to worry about all of a sudden all these sperm building up in the testicles and the testicles exploding or anything like that. That's not going to happen. Also, keep in mind that because there's no obstruction up where we have the prostate and the seminal vesicles here, prostate gland here, so ejaculation and the ejection of fluid out the urethra can still occur. So ejaculations will seem fairly normal. There just won't be any sperm in them. So this is genius, right? This is a great way to permanently make somebody not able to have kids. The nice thing about vasectomy is that the vas deferens, as you know, comes down into the scrotum here, and it's actually pretty easy to make a tiny, where's my arrow? Here we go. A tiny little opening in the scrotal skin. Pull the vas deferens up through that tiny opening and tie and cut and cauterize it right there. So they can actually do this in the office with just a little bit of local numbing medicine like lidocaine, like at the dentist's office, and either no sedation or just some really mild medication to relax the patient. So this is a much less invasive procedure than having the fallopian tubes tied and ligated, and it's also very highly effective. This is a picture of what that looks like. So this is the penis here. They've wrapped some gauze around the glans penis. We can see the scrotum is back here. They've made a tiny opening in the skin of the scrotum and brought up the vas deferens, which is this kind of off-white colored tube that you see here. So they've kind of pulled it up from the scrotum, and they're going to cut it and cauterize it and tie it off and make sure that sperm can't get through. Of course, they have to do this to both vas deferens, right? They have to do it on both sides because you have two testicles, two vas deferens. There is a YouTube link here where you can actually watch one of these vasectomies being performed. It's a pretty cool procedure, but perhaps not for the faint of heart. So vasectomy is highly effective, but it's very important that the person has at least 30 ejaculations and 2 consecutive samples that demonstrate no sperm before you can rely on it to have worked and be effective for birth control. I have a friend from high school who learned that the hard way, and now they have 3 kids. So you want to make sure you follow those instructions, right? You want to make sure that yes, it worked, yes, the sperm cannot get out. And just to remind you that orgasm and ejaculation still occur normally. And then I also want to point out that this is meant to be permanent, right? This is meant to be irreversible. Here we go. Now, some people will life changes, right? Things change, and sometimes people are like, oh, I want to get it reversed. Now I have a new partner and they want to have children. And so there are some surgeons who will attempt to do reversals of a vasectomies, but the likelihood of success is poor. So please don't get a vasectomy planning on being able to get it reversed someday in the future. That's really difficult to do and has a low likelihood of success. So vasectomies are an excellent method of contraception for couples long-term once childbearing is finished because they're highly effective and it's a relatively low-risk, simple procedure. It's not nearly as invasive as a tubal ligation. So in summary now, we have talked about all of these forms of birth control. And so I want to show you this graph because what we have up at the top are the most effective forms of birth control. So sterilization. So either a tubal ligation or a vasectomy, greater than 99% effective at preventing pregnancy, right? Both types of the IUD, right, hormonal and copper, are more than 99% effective, and the implant is also more than 99% effective. So we have lots of good options for people, but only 2 of these, right? These are our LARCs, our long-acting reversible contraceptives are reversible. Sterilization is meant to be permanent. Then in the next tier, we have ones where the typical usage result in 6 to 9% risk of pregnancy. So that would be Depo-Provera, the injection. That is probably the most effective of this group. And then we have the CHCs, pill, patch, and ring here. Next tier down, we're looking at condoms and other barrier methods, right? So condoms, cervical caps, sponges, and diaphragm. And our least effective methods would be the spermicide, and also for typical use, the fertility awareness based methods would be down here in this lowest tier. Now, all of these are much more effective than using nothing, right? So if you use nothing for birth control, hello kitty, you have an 85% risk of getting pregnant within a year, right? So 28% is much lower than 85. So always use something if you don't want to get pregnant, and ideally you can use some of the most highly effective methods to prevent pregnancy. So that's it for contraception. I look forward to your questions, and I hope you're all doing well.